Hello everyone, honorable doctors, distinguished guests, learned speaker, expert panels, ladies and gentlemen. Assalamu alaikum and thank you all for joining today's webinar. My name is Dr. Saleh Ahmed and I will be moderating today's webinar, which is Building the Future with Family Doctors. Just a quick note, this session will be recorded, so please make sure your video is on and turn it off if you don't want to share your video on the social media later on. We have joined the presentation listening using your computer speaker system by default. To keep the quality of sound functional during the presentation, please mute yourself when you are not sharing. I may also mute the room if necessary. If you have any question during the presentation, please type them into the chat box and I will collect them all and address at the end of the presentation in question answer session. This webinar is also broadcasting in Facebook Live, so you can put your question in the Facebook also. As you all know, 19th May today is World Family Doctor Day, which was first declared by WONCA in 2010, and since then it is celebrating globally. This year, the theme is Building the Future with Family Doctors. Family physicians are the key to strengthen the healthcare system and work with multidisciplinary team of healthcare professionals to achieve high quality, affordable care to all, which is the prime focus of WHO. Family physicians are the primary care physicians who serve the community in primary level with the comprehensive healthcare for the people of all ages. In this pandemic COVID-19 situation, they are doing excellent role providing healthcare facilities to the patient. In this context, now I would like to introduce our presenter, Dr. Lieutenant Colonel Muhammad Kabir Ahmed Khan. Dr. Kabir is a pioneer family medicine specialist in Bangladesh. He obtained FCPS in family medicine from BCPS in 2009 and also achieved MCPS in family medicine, MPH in public health, FCGP from BCGP. He has 9 publications so far in national and international journals. He is the member secretary of Faculty of Family Medicine in BCPS and chairman platform Family Medicine Wings. Now Dr. Kabir is working as a consultant family medicine in Prava Healthcare. He is a very well-known face, speaking in television, electronics media, print media. His main focus is to establish family medicine in Bangladesh and make it popular among all. Thank you, sir, for being with us today. Now I want to invite Dr. Kabir to give his presentation. Over to you, sir. Kabir sir, your presentation session.
এটা যাচ্ছে না শেয়ারিংটা
না শেয়ারিং করতে পারছি না
এই তোমরা কার কাছে যে আছে ওইটা অন করো এটা আমি এখানে রাখছিলাম এটা যাচ্ছে না কেন গেছে তোমরা কি দেখছো কেউ হ্যালো
Yes, we can see.
সাউন্ড তোমরা কি দেখছো
হ্যাঁ হ্যাঁ দেখা যাচ্ছে
Okay. Thank you, Dr. Saleh Ahmed Shaun, for your kind introduction. Respected panelist, our honorable guardian in the field of health service in Bangladesh, Professor Rashid Mahabub sir, presently working as the Joint Secretary in Bangladesh Diabetic Society, Professor Kanuvala, another professional leader, ex-president of WONCA South Asia region and medical director of Bangladesh Institute of Family Medicine and Research. We are also honored and lucky to have two foreign dignitaries with us today. Professor Raman Kumar, President of WONCA South Asia region and President Academy of Family Physicians of India, and Professor Hina Jawaid, a dedicated professionals in family medicine from University of Health Science, Lahore, Pakistan. Ladies and gentlemen, Assalamu alaikum and very good evening. At the very outset, I would like to express my sincere thanks and gratitude to Platform Family Medicine Wing for organizing such a important but apparently neglected health issue in our country. So I welcome you all to my presentation on building the future with family doctors. Actually, this is the theme of the World Family Doctors Day. I can give a few words regarding the history of World Family Doctors Day. In 2010, World Organization of Family Doctor, commonly known as the WONCA, declared 19 May as the World Family Doctors Day. Since then, it is gaining momentum globally every year and in all countries. The aim of that declaration was to create an attention to the contribution of the family doctors in their primary care healthcare delivery. At the same time, the increasing the morale of family doctors amongst themselves. The WHO, World Health Organization, also recognized that day and encouraged its all regions and member organizations to acknowledge it and act accordingly. In every year, they set a theme for the day. This year, they set this building the future with family doctors. This theme is aligned with the Year of the Health and Care Workers 2021, which was declared by the WHO. And it is based on the 4 fundamental pillars with key elements to more achieve the challenges to give the better health delivery. The first one is the building the future with family doctors and primary care teams. This primary care teams is the multidisciplinary members of the primary care team. Those who are the building blocks for the healthier future. And to extend the global health care system and deliver affordable and highly qualified care for all, it is very crucial to support the family doctors with this multidisciplinary primary care team. And the second pillar was the building the future with family doctors and patients. And this is the important one because the patients are the center of all celebration. Family doctors are providing continuous and comprehensive care. Family doctors, by which family doctors build the bonds of trust with the patients and enables high quality person-centered care. By the way, family doctors promote the patient-centered care and they achieve the mutual respect, dignity, and trust, and closing the healthcare gap every day. And third one is the building the future with family doctors and new technologies. We know the family professional development, education, and training of the family doctors or the primary care team would not be possible without the innovation of new technologies. So family doctors integrated new technology to empower people and improve the health and well-being of the common people. You know, in this pandemic situation, the telemedicine and teleconsultation has become the tremendous role to manage the patients remotely. and family doctors and primary care team to carry out their through telemedicine and tele consultation. They carry out their mission and they increases the access to service remotely. And fourth one is building the future with family doctors and you. Here they are mainly the family doctors are in the position to identify the needs and bridge the gap between the social health and the social requirements. So family doctors and primary care team are the key players in preparing and building healthier future for all. So we need to onboard everybody, not only the patients, every other persons also. In this regard, we can say that if investment in this in a strong and safe primary care, then it will be the best possible options to achieve the universal health coverage, which is the present goal from the World Health Organization. And few words about the as the young doctors are here, I want to say few words about how the concept has come of family doctors or family medicine. You know, for thousands of years, physicians were the journalists. That is, for every health-related problems, people has to report to one doctor who was the journalist, and he had to look after the all sorts of complaints of health-related complaints. But gradually, medical knowledge expanded and technology advanced, especially after the Second World War. It has created a tremendous role that since then the physicians choose to limit their practices to specific and defined areas of medicine. Ultimately, the healthcare has been fragmented in various sections and created the many specialties and subspecialties. Initially, people were very happy by getting the specific specialist for their diseases, and doctors were also happy by concentrating their field of activities in one subject, one section. But gradually, the people realized that they lost their old family friends to whom they were usually reported with all the family members with all sorts of diseases or all sorts of complaints of health related complaints. So at that time, again, the doctor patient relationship had been deteriorated, and people's and few senior doctors were started thinking that this expanded knowledge, this advanced technology, including all those things, they have to be a specialized subject which can be covered all the generalized complaints in the primary care level, and they designed a training pattern which was named as the family medicine, and the family doctors are the specialist with the family medicine. The family medicine specialist has become the family doctors, and thus the ancient generalist practice has become the specialist practice. Now it is known as the family doctor. So few words about the family doctor. It is obviously by this time we understand that family physicians are that physician by all family members can report with all sorts of medical needs, irrespective of age, gender, and organ involved. That is, in a family, maybe in the infants to old, male to female, or any sorts of problem, they can report to a physician. He's the family physician. For family doctors, so family doctors has to be equipped with the diverse health needs. For that reason, I already mentioned that family medicine is designed with all covered by all these diverse health needs, so that the family medicine specialist can give sufficient service to almost 80% of the health related problems at the primary level. And they always linking the community with the higher medical center specialist health care. So family doctors is always uh, a role, the pivotal role, by establishing the effective referral system, which is very much essential for a successful health delivery system. And they also reduce the health disparities in underserved population, because the remote areas, the the patient doctor proportion is just reverse in the rural and the urban area. So family doctors can be strengthen the primary care in the remotest area to achieve the universal health coverage. So in the ultimately we can say the multiple evidences suggest that family doctors can provide quality and cost-effective health care, and also can strengthen the prevention and promotion of the health-related activities in the community. That is, they not always deal with the patient disease and patient. They also deal with the prevention and the promotion of the health related in the community and the family. So if we look towards the global situation, what is the global situation now? Actually, the family medicine started since 1969 from USA, Canada, and UK, and ultimately it gets momentum with the establishment of the WONCA, that is World Organization of Family Doctor, in 1972. Since then, it spreads towards the Asia Pacific countries like Australia, New Zealand, Singapore, and Philippines. And World Health Organization declared Health for All program in 1978. It recognized that the strong primary health care is the key to attaining the target. That was the intellectual foundation actually for the family medicine or the family doctors. Since then, family medicine and family doctors are the dynamic state of rapid development in many regions of the world, and become the well-established and mainstreamed in the Western countries. In all over the Western countries, Australia, Canada, Singapore, Philippines, all countries, the family physicians, family doctors are providing the primary care, and without the referral from the family doctors, no specialist can see the patients. But the scenario is just reverse in the low and middle income countries like South Asian countries, including Bangladesh. Though family medicine is independent subject, but it is not familiar till now. But we know the health is the fundamental right in our constitution in Bangladesh situation, and health and family welfare or ministry is looking after the health of our country. Like all other countries, we have also 3 tiers to deliver the healthcare to the common people. That is primary, secondary, and tertiary. In our country, in the primary level, the village level, we have the community clinics. The union level, we have the union health and family welfare centers, mother and child welfare centers. And in the Upazila level, there is the Upazila health complex. All these 3 component is providing the primary health care. But unfortunately, these initiating facilities is not functioning properly. For that reason, the secondary and tertiary level hospitals are not working properly, and they are now overburdened. The scenario, what are the scenarios there? We can see a few points here, that in our country, the referral mechanism is almost non-existing in all the facilities. That is primary care, the 3 layers, and the secondary and tertiary care, the referral system is not existent. And we are using the manual paper-based record keeping still now, and the patients commonly bypassing. For that reason, as the referral system is not existed, so the patients are bypassing the primary care facilities and seeking care directly from secondary and tertiary facilities, and ultimately those facilities are overburdened. And why the people are not taking this pathway to go downwards to upward? Because this referral slips doesn't have any utility. Yeah, there doesn't have any advantage or priority for treatment, or even they doesn't know record that paper to show in the higher installations. And again, there is no feedback mechanism. That is the main component of the effective referral system. And again, ultimately, what is happening? The wasteful duplication of the diagnostic testing and the polypharmacy and confusion about the conflicting care plan, it contributes to the poor quality of care. And this is the main dissatisfaction of the common people towards the healthcare delivery organizations. So if I summarize the primary care challenges here in the Bangladesh, people can go to any specialty or any doctor. That can be said as the doctor shopping. And people also, primary care concept is not there in our general population. They don't know that the primary care facilities can, or family doctors can give them the much better service than the others. And family physicians can practice. Again, this is the another problem in our country. You know, the in rural areas, the 70% people are living in the rural area, but our 75% physicians are living in the urban area. For that reason, there is no distribution of the specialty, and no physicians can practice anywhere whatever they want. And again, some primary care level, the competent clinicians also are not there. For that reason, suppose in our country, the community clinics, those are devoid of any qualified doctors. So people are not confident enough to go all those places, as there is no qualified family doctors or the family physicians. And importantly, our specialists also not in favor of this family doctors or the family medicine concept. Rather, they are dismissive to this concept. And another one important one is that our young generations are not interested to take the career in family medicine or family doctors, because there are so many causes are there, as there is no scope to further flourish or have any position in the healthcare delivery in Bangladesh. So they are not giving any time or labor to become a family doctor, to become the family medicine specialist. So I took few points how we can come out from those problems. This is obviously we have to have some policy directives with detailed roadmap from the government as well as the professional bodies, and we have to have the structured cadre in the healthcare delivery system, so that the young doctors can see that they have some positions in the healthcare delivery system. If they become the specialist in the GP or the family medicine, they will be posted that places. So this should be a structured cadre, and post-graduation specialization of the family medicine should be established in our facilities, medical facilities. And we are very much deficient in the family medicine teacher, so this should be looked after. And the family doctors awareness in the general population, also we have to raise awareness to the general populations that family doctors can be the best friend, medical advocate for them, for their any sorts of health related problem, and they will be the first gatekeeping activities, so that they can go in proper place if they require. And importantly, last one, the effective referral system is absent in our country, though there are so many rules are there. Without prescription, antibiotics should not be right. But many rules regulations are there to implement, establish a clinic, laboratories, and pharmacies, but all those things are not implemented. So all the haphazard systems are there all over the country. So the people are suffering from getting a proper health service. And I keep one slide for family doctors' role in the current pandemic. You know, this pandemic situation, it taught us the many things, new things, and we adopt, evolve, and thrive in both provider and the clients, the patients. patient's part. Here, the family doctors can have a gatekeeping role, and they are doing all those things, becoming the indispensable for the control of the, not only the control the influx of the patient, but also the spread of the COVID-19 among all. So here they are using the telemedicine platform, which permits family doctors to efficiently and safely examine, interview, and triage and monitor the patients remotely and manage them as appropriate. This is very important because we know that this pandemic, the 80 to 85% patients can be treated at home, and that can be monitored, that can be managed by the family doctors, and that should be the through telemedicine platform. And the crisis has put these family doctors are the ultimately this crisis, this pandemic shows us that the family doctors are the center of the healthcare system and highlighted its strength more than ever. It is a new role for the family doctors. So I want to conclude with a few words that internationally there is growing demand for the comprehensive healthcare. So as in our region, we cannot be lagging behind from the other countries. We have to be with the with those developed countries to provide primary care through family medicine specialists, family doctors. And so need of the hour is to understand and incorporate in our healthcare system well-trained family physicians who may form the backbone of our healthcare system. And this time the pandemic COVID-19 is not the first pandemic, not it is the last one. So the family doctors need to be responded to the increasing need of people and the overall nation. So we hope in due course of time, family doctors concept will grow, evolve, and eventually develop its own identity in our country and in our area. Perhaps this pandemic, this COVID-19 will give the impetus for further development in these areas. So I want to conclude here. If anybody has any question, then I will be answer within next 3 or 5 minutes, and then our panelists will start their discussion on this World Family Doctors Day. Thank you.
Thank you, sir, for your very nice presentation. Now we come to the question and answer session. If you have any question, you can.
কোশ্চেন আগে প্রেজেন্টেশন গুলো হয়ে যায়, কোশ্চেন পরে করে, কারণ তাহলে শেষ করতে পারবেন না।
স্যার ঠিক আছে স্যার, ইয়ে
Okay.
please.
Due to some time constraint, we have time constraint today. If you have still question, we can answer it later on. Then next session. Now I'd like to go for next session is opinion of panel of experts. Before starting this session, I would like to introduce our learned panel of experts. Today we have with us Professor Dr. Rashidi Mahmood Sir, a renowned surgeon and successful professional leader, Joint Secretary Bangladesh Diabetic Society, President National Right Movement, and member of National Health Council of Bangladesh. He was ex-Provici BSMMU, ex-President BMA, ex-President BCPS, and Chairman BMRC. Now he is being appointed as an UGC professor in Bangladesh University Grant Commission. Thank you, sir. It's our pleasure that you have joined with us. Next, we have Professor Dr. Kanu Bala, a leading family medicine specialist and a PhD scholar in Bangladesh, who has been working in a family medicine sector since long and conducting a family medicine course, FMD. He is a professor and medical director of FMD course in Bangladesh Institute of Family Medicine and Research and Bangladesh Institute of Ultrasound in Medicine and Research, and board member of MRCGP International, Royal College of General Practitioners, UK. He was also the ex-president of WONCA South Asian region. Thank you, sir, for being with us. Today, we are very lucky that we have two learned experts from India and Pakistan. Now, I would like to introduce Professor Dr. Raman Kumar, President of WONCA, South Asia region, and Editor-in-Chief of Journal of Family Medicine and Primary Care. He was the leading family physician and founding president of Academy of Family Physicians in India. He was being rewarded with many national and international awards and recognition. Thank you, sir. Now I am introducing Dr. Hina Jawed from Pakistan. She has achieved MRCGP in 2013, MSc in Surgical Science and MRCS. Now she is working as an assistant professor, family medicine, University Health Science, Lahore, Pakistan. She worked in UK as general practitioner and primary care physician. She has more than 15 years experience in family medicine and involved in development of undergraduate and postgraduate curriculum in Pakistan. Thank you, madam, for your being with us. Now I request Professor Dr. Rashidi Mahbub sir to deliver his speech in World Family.
Dr. Saleh, can I have 1 minute? Dr.
Sure.
Raman Kumar have another important job. Can you have the comments from Dr. Raman Kumar first?
Oh, sure. Thank you, sir. We have a very learned speaker, Dr. Raman Kumar sir. As you know, there is a lot of challenge for family physician, especially in Southeast Asian region, to do his career in family medicine. Now I request Professor Dr. Raman Kumar sir to deliver his speech and enlighten us the present situation of family medicine in South Asia and future plan of WONCA to resolve it. Another, we also know that in India, COVID-19 situation is very alarming, and requesting sir to share his experience that how family medicine doctors are serving in this pandemic, their role, hurdles, achievement. Over to you, sir.
Thank you, Dr. Saleh Ahmad, respected panelists. Thank you, Colonel Kabir, for inviting me to this panel. Our respected colleague, senior mentor, Professor Kanu Bala, our very dear colleague, Dr. Hina Javed, and respected professor and vice chancellor from Bangladesh. It is Professor Rashid Mahbub. Thank you all for having here and celebrating World Family Doctors Day. And I bring greetings from all WONCA family all over world, especially South Asia region, from all countries, being the present president of South Asia region. I would start the relevant part speaking. I'm not using any slides, but as we are going through this pandemic time in India, and we had a huge surge of cases during past few weeks, started somewhat in middle of March through April, and now it has calmed down, especially in the regions where it was very hard hit in the beginning. I was getting around, personally, I was getting around 100, 150 calls a day, and I had to organize myself technologically very much to be able to cope up in my own practice. And I was also using one of the practice apps, which is called Practo, which is one of the most popular practicing online platforms, digital online consultation tool in India. And we have a working collaboration with them also. So I received a call from them, and they informed that there is a huge demand for family physicians, general physicians all over India, especially during this pandemic time. Why? Because in general also fever, pyrexia is the commonest symptoms that our community or population suffers. We have this double burden of infection and non-infectious diseases, and almost everybody of our population would have suffered fever once or twice in a year. And when this time, even during the time of pandemic COVID, it presented primarily as fever, people had tendency to visit or go to a general physician. And especially, I mean, if you look scientifically also on the COVID presentation symptoms and the spectrum of the problems that you see in COVID, it is a multi-system disease, though it primarily people relate it with the respiratory symptoms and the pyrexia symptoms, but it is a multi-system disease, and you have to be very, very knowledgeable about all systems, different impact it can bring to different functions and physiological status in the body. And unless you are a generalist, you would not be alone able to cater to the patient's overall needs. And this COVID pandemic has especially brought forward how family physicians, family doctors are very, very important in the present time. And we are not just useful, but you are, I saw thousands of patients during, past few weeks, and not to boast, but because of this, background of seeing patients often with this kind of symptoms, cough, cold, fever, and associated symptoms, other problems, something related to sugar, diabetes, hypertension, other multimorbidities, elderly patients, young women, pregnant women. All situations came to us, and we were competently able to deliver care and cure patients. And among more than thousands, and at least 2.5 thousand to 3,000 patients I saw, and among them probably maybe 15 or 20 required admission. A couple of patients died also, in hospital when it was required. But largely we were able to save patients because we understood how the disease evolves, or how the uh, the mechanism of the pathology of the disease manifests in the patients. And the tendency all over world, especially in our country also, was to give some kind of guideline treatment or package treatment, where there would be some antibiotics, ivermectin, paracetamol, zinc, vitamins, vitamin C, and all. But to understand from a family physician's perspective, each person had a different disease. It is okay to give paracetamol in the first 4 or 5 days, which is useful, but many patients do not start with fever itself. Somebody may start with coughing or sore throat, or malaise without fever, body ache, headache kind of symptoms. And these symptoms diverge from day 4, 5, 6 onwards, and each person has a different disease after the first week especially. So each person requires the treatment be matched with the symptoms. Many people come and presented with loose motions, but the package treatment was of doxycycline and azithromycin being given, which are not suitable for person having loose motions. And many times patients were not even addressed for their symptoms. If somebody is having too much of coughing, then it must be addressed to. If somebody is having vomiting, it must be addressed to. If somebody is not able to take orally, it should be addressed to. Unless these things are done person to person, and that what the concept we call in family medicine is person centered care. And that saves lots of life, because if you push through some kind of a general treatment for everybody, it does not meet the requirements of each person. Because if I give an analogy, the car is the same, the traffic is the same, but each drive is unique. But each patient's illness is unique. I mean, you have to go through that. Otherwise, if you move in the same gear or use the same speed limit, you will make crash. And that has happened with many patients. Similarly, I've seen patients being treated by ENT doctors or chest physicians or surgeons, but all of them have limitations in their own roles and responsibilities that can they take care of in a COVID patients. So from COVID itself, it requires a generalist approach from a generalist physician, and that would be sufficient most of the times in saving lives. We have managed moderate cases. Hundreds of patients of these 1,000 patients I've seen had drop in their oxygen levels between 88 to 94, and large majority, I would say almost all of them, were salvaged. They recovered within this period of especially in the second week, when there is a challenge of which we many times call the signs of inflammation, high grade fever, excessive coughing, extreme fatigue, all these symptoms we were able to manage, fall in oxygen at home, on telephone conversation, on WhatsApp video conversation like we are having this time. And because we were connected directly, I was connected along with my team directly with the patients. We were getting regular updates on the patient's vitals. Simple things like pulse, oxygen, and temperature. If you get twice in a day, or whenever patient feel uncomfortable, it is, you can immediately act upon and increase, or match your treatment to the patient's requirements. And this thing also cannot be taken properly care in hospital setting, because in hospital also works in clocks and cycles of rounds. Once morning there would be a round, and if nurses also take vitals of the patients, it would be time bound, morning, afternoon, or night. So, in cases of COVID, the symptoms are dynamic. They are often evolving. They are not stable. They are always not the same. I see a lot of guidelines where they classify patient on mild, moderate, and severe grades. But unless you define those mild, moderate, and severity on timelines on day 1, 2, 3, 4, 5, 6, 7, 8 to 15, it is of no use in management, because you will not getting. And the situation that it evolved in India, many times we had to work without RT-PCR tests, because the tests were being delayed. We were getting reports after 2-3 days. In hospitals, it is easy to offer or ask for D-dimer, IL-6, CRP, and all, but these tests are regularly not done in community setting. So we had to go, and CT scan was being done so often for the chest. But largely all this can be matched with the signs and symptoms of the patients that they manifest. So if somebody is having oxygen saturation of 92, you can easily correlate, and it is common sense and logic to use that how bad would be the pneumonia. If somebody is having oxygen saturation of 85, you would easily can relate what the CT scan would be would look like. You do not do a CT scan, you can work clinically with your common sense and save the patients. And that we have done in many times in most of the patients, because and many times even patients when who were capable of getting CT scans done, they were getting it done on a wrong day. Somebody is doing CT scan chest on third day of illness, and feeling safe about it, and I've seen such patient dying on the 7th, 8th, or 10th day. So because of this misinformation, or excessive information flow, it was very, very difficult, challenging situation even for the patients and the doctors to collaboratively work. But when you have trust of a family doctor, it works better, because they want to know from their doctor. Even nowadays, when people are talking about black fungus, I'm getting a lot of calls from the patients, because they want to be sure that it is nothing to be worried about. They ask questions from their family doctors. Many times they ask questions on, or opinion on, blood thinners, whether I should take blood thinner, or this type of thinner, or this dose of thinner. And when we say as family physician, they would trust us. So this is general about family physicians, family medicine role in the COVID times. And it is proven beyond doubt in India, and I can say across all India, for all family physicians to digital systems. India, we have large number of private practitioners. 85% is in private sector, and OPD 85% is being taken care of by private people. So those are the people were taken care of by general physician, generalist physician, GPs, and family physicians. And this time has shown that we really, really need family medicine, family physicians. In general, I hope the situation all of us in our countries is similar. We face systemic challenge in our regions. Why? Because primarily our primary care approach is disease centered, which we call primary care, selective primary care approach. Whereas when we talk of UK, US, Australia, New Zealand, Western European countries, it is comprehensive primary care approach. Because of this concept is not taught in our system itself. Most of our senior faculty, even our directors of big institutions, are not aware of the difference between the primary care, which is selective primary care, and comprehensive primary care. So family physicians part of the scheme where it is comprehensive primary care. They will be strengthened when there is comprehensive, where illnesses, morbidities come irrespective of differentials. Where in our region mostly we are aligned. Our systems are aligned for diseases like we had a big pulse polio eradication program. Similarly, We have a national program on tuberculosis. We have programs on infectious diseases, cancer diseases, non-communicable diseases, and these all structures, trickle down from top and consume a lot of resources. And for example, I give you, we have a big tuberculosis program, which is useful, no doubt, and we eradicated polio in India. But if you look at the tuberculosis program, the DOTS program, it does not treat COPD, it does not treat bronchial asthma, it does not do any help with smoking, it does not treat cough and cold, it is of no use in COVID times. So all these structures, all these 700 districts in India have district tuberculosis officers. I'm not criticizing a program, but what I am saying that along with this approach, we need to have comprehensive primary health care. Unless we have comprehensive primary care, the population and morbidity like ours, India, Pakistan, Bangladesh, Nepal, Sri Lanka, all are of a similar nature of diseases. We have similar, challenges of population and morbidity. So we cannot address, and we are spending money, our government money, public health money on vaccines, screening, but we are not treating common problems. If somebody has fever, it is not being addressed properly. Fever is the largest problem, but we are counting on the diseases, spending our resources, aligning our resources on the specific diseases, and when problem like this arise, system fails because system is not aligned to treat general problems, common problems. So this is a big lessons. We have tried to reach out to our governments, authorities, medical associations to tell them. We will be writing in our journals, in our editorials about this need, and we will be reflecting upon what is being required, especially in context of comprehensive primary health care and strengthening and need of family doctors and general practitioners. And today is a day when we commit ourselves nationally, internationally, locally, and we re-strengthen our own belief in the system we are working together. And personally, if you ask me, I do not support family medicine because I am a family doctor or I'm trained in family medicine. I truly believe because it is needed for our population more than in the Western world. It is required in our part of the country, and it is not necessary to do emphasize any. Many times we feel people don't want it, but people don't ask your qualification. They ask you, "Are you a doctor? Will you treat my disease? If you treat, they will get you." I mean, during this COVID time, because I was getting so much of, I'm completely private doctor. My fee was 500 rupees. I had to, to be able to cope up the number of calls, number of patients, I had to increase my fee to 1,000 rupees. So even as a family physician in a national capital area, I'm able to command a good, respectable fee, which is, I mean, in Indian currency, it is okay. So I don't think there is a financial lack of sustainability or any problem. Still, people are coming to me. Even if I see 10 patients, I earn 10,000 rupees a day. So I mean, financially, it is not a problem. This has to be emphasized on our medical students because this comes from the community needs. This comes from our population needs, and nothing what our population needs is the need of the profession. So there's a lack in the education system, in our curriculum, MBBS curriculum, the medical education system, that has to be addressed. It is not fault of the students because we cannot blame that for something they do not know. So that is all from my side. Thank you for your time, and I wish you all very best. And I'm sure this message will go across, especially after this COVID pandemic. We will all continue to working hard, explaining to our governments, higher officials, bureaucrats, medical associations, the importance of family physicians. And also simultaneously, we will continue to provide our services in a way which is cost effective and fruitful to the general population. So thank you all, and thank you for the excellent talk, Colonel Kavir. You gave a very good background of family medicine, how it evolved historically. So I just experienced my practical things which we had during this pandemic, and in general, our message on behalf of WONCA as a world body. Thank you all.
Thank you, sir, for your very informative speech. And we would like to congratulate you as your family medicines, family doctors in India is doing excellent job in pandemic and also in normal situation, especially controlling in tuberculosis program. We will definitely want to learn from you later on if time permits. Thank you, sir.
I will join back once I'm done with the other session. I'll be back. Thank you.
Now I would like to request Dr. Hina to deliver his speech and want to know more about the condition of family medicine in Pakistan. We also want to know how Pakistan family doctors are serving patients during this present pandemic situation. Thank you. Over to you, madam.
Okay. Thank you very much. Thanks to Dr. Kabir for giving me the opportunity to talk. And hello to the esteemed panelists, Professor Mehboob, Professor Kanubala, and Professor Raman Kumar. It's a privilege to be here, indeed. And it was lovely hearing the speech from Dr. Kabir and Dr. Raman Kumar. And I was writing the comments in the chat box because I was agreeing to lots of things you all were saying, and it was like echoing my own thoughts. In the beginning, we talked about the building blocks. Now, the building blocks of family medicine is we know very well, but I just want to highlight a few areas. Things like leadership. Leadership is important to be part of the training. When our trainees are undergoing a structured training pathway, a program, like a 3-year or 4-year degree program, leadership is something that needs to be incorporated in it. Reflective learning is another thing that needs to be incorporated. We need to reflect on our activities and learn from it. The leadership also includes being fair. Now, when we say that, we talk about things like probity, honesty, accountability, and medical ethics as well. And I think these things are quite compromised in our setup. And I can certainly talk about mine here in Pakistan. I remember when I first came and I wanted to talk about medical ethics in general practice, I was told by the organizers this topic won't go down nicely. I know the actual facts why it wouldn't go down nicely because of our inclination towards the pharmaceuticals. And I had to raise voice about pharmaceutical directed general practice prescriptions and stuff, and the antibiotic stewardship. We also have an issue with regards to excessive use of injections, the needles. For some reason, globally, we are leading in the number of injections per person per year. The current stats, as per WHO, is 8.9 injections per person per year, which is largest in the world. And that is leading to the needle, the syringe, and the drip set reuse as well. Something we have to take very, very seriously. As I said, and the other thing that the family medicine doctors need to do is patient advocacy, because that leads to patient safety, that leads to improvement in the standard of care. I am a visiting faculty in one of the primary care centers just outside Lahore. It's a suburban area, and I had to introduce clinical audit there. Now, my students who are into the clinical audit, first they were running away from it because they thought it was something very, very difficult. But we started with something simple, prescriptions. Okay, let's look at the prescriptions for sore throat in the last 1 month. So we carried out an audit in February. We looked at Centaur criteria, whether our doctors were recording the temperatures, looking at the throats, checking the cervical lymph nodes and stuff. Basic, simple stuff, general practice stuff. And we identified a lot of deficiencies there. And now my students want to do audit on a regular basis because they've learned how to do it. I had to teach them critical appraisal of literature as well. When you're reading the evidence, what you need to see, what you need to look at. Again, a very difficult thing to do. And I agree with Dr. Raman Kumar when he said that he gave family medicine the much needed spotlight we needed. Last year, I was involved in supervising a telemedicine center during the first wave of COVID-19. And where the family medicine came was when our junior doctors had to deal with non-COVID calls, when they had to write prescriptions for things like typhoid, allergic rhinitis and stuff. They had training for COVID, but they didn't have the training for non-COVID issues. So that's where the system fails, that we can't deal with it with the specialist. We do need the specialist, don't get me wrong. But for instance, a gynecologist is not able to treat a chest infection. You need a generalist for that. So hence, then we were given that kind of entrance, the opportunity, and we worked there for about 6 months. And it was acknowledged at the highest level. The governor of Punjab invited us, and we were given shields and souvenirs. So grateful for that. Then I had to introduce research among my students. I conducted a master trainer program. Now, the cohort that was given to me, 25 participants, they came from a non-training pathway. We have non-training pathway in post-graduation in Pakistan. Again, that is something we are working on. We are trying to make training mandatory. And again, there are lots of challenges we are faced with because we are trying to bring the reforms. And some reforms have been taken for the very first time in the system. So that's a huge change. It's change in the behavior and stuff like that. So yeah, I mean, I'm on these forums, and I get to read the activities that you people share from the region, and it's really encouraging because it seems like we all are in the same boat. We cannot work in isolation. By we means the family physicians. We are community-based. We need other teams. We need teams like physiotherapists, chiropractors, podiatrists, and the specialists, of course. The other thing I struggle with in the Pakistan, because I work in the UK as well, and I work here. And I think in UK, the one thing that we have is non-pharmacological options that we can give to patients, for example, support services for mental health care. And I struggle with that here. Things like cognitive behavior therapies, things like different psychological basic counseling, low intensity therapies and stuff like that, diabetic foot care, simple things like skin callosities, bunions in elderly. So for foot care, I'm really struggling where to send my patients. So I think non-pharmacological management is something we have to bear in mind and raise it at various levels. Like I have to deal with the provinces. I have to be in meetings with the ministries of bureaucracy. So these are the forums where we can raise the ground realities and can be real patient advocates. And I think it's time for bold decisions in the right directions. I'm not a big fan of pilot projects because I know it kind of, we already know there's plenty of evidence available, what works and what doesn't work for primary care. So why can't we use the existing evidence and utilize the resources appropriately rather than wasting them? I think that's about from me. I would be happy to take any questions, and thank you once again. Dhanyawad. Okay.
Thank you, madam, for your nice speech. Now I would like to request Professor Dr. Rashidi Mahbub sir to deliver his speech in World Family Doctor Day 2021 and put his comment regarding our program.
The thing is that the World Family Doctors Day, definitely it is a program of World Health Organization, and mostly in this region, it is done by WONCA. So it is a congratulation things, and there is a family doctors or GP, whatever we say, they are the doctors who used to take care of the most of the patients. In the Western world, this is a structure articulated, and they have a system in which there is a place. Because most of their health system is nationalized, but in Southeast Asia, picture is completely different. Because here it is not nationalized. Mostly family doctors are private practitioners. They work in the private level. But previously, it was there, but nowadays, with the advancement of the medical sciences, it is a specialization. And that specialization is adopted by the Western world. But to us, we have not yet articulated with our health system. So all the people who are doing the private practice, they are on their personal or private capacity. There are two things is to do. If I go back to 50 years back, these things is very simple, because people has confidence on doctors in the Southeast Asia. They are next to God when they used to treat them. Now with advancements of technology and other things, people's also demanding is much more. So they are not in a position to work only as a God, because technology and the skill and the communication and other behavioral thing is nowadays is a part of a medical practice. So in those days, we have got a very little experience on it. In Pakistan, there is a course in the Pakistan College of Physicians and Surgeons as a family medicine. In Bangladesh, we have. But this course is mostly an academic. We don't produce, so we have not given the stress on skill. So in the MRCP family medicine in UK or Australian based or American based, they prepare these doctors with the skill and knowledge to do the catering the service according to their need. And here we are trying, because Kanugopal knows he is spent all his life for these family physicians and the practice. But we are yet to get a head of it, because it is a decision and policy making. It is a government affairs. We are placing all the time of our demand. Even there is no course in the public universities or public medical college like family medicine. So it is only in the private level, except the College of Physicians and Surgeons, and Kanulal has done under the coverage of a private university. So we don't know how much we will able to do, but it is the need of the time, and it is mostly needed that policymakers, we had to motivate policymakers and the politicians. So that is the thing we wanted to do. But if we can't do, then these things will not develop. Another problem has come nowadays, that we are having a bright medical graduates, but these medical graduates is not prepared for the GPs, because they are trained in an academic environment in a big hospitals. So they are not equipped with themselves to go to the field and try to pursue their knowledge for the community. So what we are trying to do, because Kabir is also knowing, that we wanted to trying a certificate course on skill development, communication and skill. Then the College of Knowledge is coming. So we are catering our general practitioners as on our need. So there are lots of models you will see in and around the world. Say, as for example, if you go to the Indonesia, if you go to the Malaysia, or if you go to the Thailand, they have a different models of it. So I don't know, my message complete and clear, that family medicine is in need of the time, and they must take the leadership to cater the primary and comprehensive health care of the people. And we wish we will able to do it successfully, if not today, day after tomorrow. Thank you very much.
Thank you, sir. Thank you to enlightened us. Our next speaker is Professor Dr. Kanu Bala. As you know, family medicine doctors in Bangladesh are still struggling. Though family medicine doctors are the key person to establish effective healthcare system all over Bangladesh and referral system from primary to tertiary care level. What are the obstacles? Why family medicine is still struggling here? To speak about the past, present, and future scenario of family medicine in Bangladesh, I would like to invite Professor Dr. Kanu Bala, ex-president WONCA South Asian region, to deliver his speech.
Thank you very much for inviting me in this program. And I think this is also some sort of recognition or appreciation to those people or those organizations who are working for the sake of family medicine. I have got this opportunity to thank Professor Rashidi Mahabub. He is the leader of the profession in Bangladesh. And anytime we just went to him with some problems regarding our family medicine programs or family medicine dissemination, he is always ready to extend his helping hand to us. So I would like to thank him very much. And you know, this South Asia region, there are 9 countries, which includes both Afghanistan and Myanmar. They are also part of South Asia. And archaeologically, historically, or prehistorically, this is a different area, South Asia. This is not a country, this is not a continent, this is subcontinent. This is something very special. And in a broad term, all the people residing this area, almost 2.5 billion people in this area, a vast majority of the world, they belongs to the same problem, same sentiment, and same type of work and everything. They are almost same. So their problems are also same. And you can see there are 3 big countries, that is India, Pakistan, and Bangladesh. India second, Pakistan probably 5th, and Bangladesh 8th biggest country. They are huge population. So they have got their own different problems. They have to feed the people. They have their education problems. So many problems. So they are not giving proper attention in the health sector. So these 3 big countries, they have same type of problem. Especially, they have failed. I have to say, with apology to Dr. Hina and Dr. Ramon, all these 3 countries, they have failed to develop some sort of family medicine in these 3 countries. But the other small countries like Nepal, Sri Lanka, Bhutan, Maldives, they have developed their family medicine very nicely. They are a small country and their problems are not so much big in the other areas. So this is the basic problem. But we have to do that. We need the family medicine. All the speakers, they have told that this is the need of this time. So there is no confusion about whether we need family medicine or not. We need it. And how we develop it, that also we know. Because nowadays, the information is in our fingertip. Just we go to the internet, we can find out what are the problems, what are the solutions. And we can modify those solutions according to our need. Then where is the problem? The problem is that is a priority. Whether health is the major priority of that particular country. And we know that all these subcontinent countries, the government is the main stakeholder. Not like USA or UK or Australia. Here is the government is the main stakeholder. Everywhere you can see the government. Nothing you can do without help of the government. So government is the main stakeholder. Government is the main initiator. At least the government, they can make some obstacle to do anything in the private sector. And what we are facing in all these countries, in India, in Bangladesh, in Pakistan, or in other subcontinents. So first of all, we have to fix our priority. And so we have to go to the politician, what already Professor Roshdi Mahbub told, that politician, we have to convince them. We have to make them understand that this is the need of their country. And every time I am going to the politicians for last 30 years. And when they talk face to face, they just realize everything. They are not fools. They are very intelligent people. They are not fools. Very intelligent. They understand everything. But then they forget that. Why? Because they didn't find any interest in this health matter. So we have to approach them in the different way. We have to talk with them that if you do all these things, you will get 10% more vote. Once they realize that if they take initiative in uplifting the health of the people, then the people will give a vote to them. If once they realize that, they will go for it. And until and unless they will not do anything for, because this is not a immediate priority. They are running after the immediate priority. So we can discuss a lot of things regarding the problems, regarding the solution, but after a long time, spending a lot of time, and at the final stage, I could realize that the main stakeholder, main person, they are the politician. Every politician are not bad. We have to make them understand that this is needed for the time. So in short, I am again just with Professor Rashidi Mahbub, I am also telling that we should change our line of action. Otherwise, we cannot make any difference. Before 30 years, where we are, still we are just struggling with all those problems. Thank you very much.
Thank you, sir, for your excellent and practical speech. Thank you, sir, very much. Now we have to come to the end of our webinar. Thank you, everyone, for your in-depth discussion. We gathered so much knowledge. We heard your opinion, further plan, present situation, and obstacles. As you said, family medicine is the need of time. From your discussion, we identify the obstacles to establish family medicine in South Asia, such as referral from primary care is not necessary to take service from secondary or tertiary care center. Specialists not encourage patient to visit family physician for general problem, and back referrals is almost zero. Young doctors are not interested because for family physician there is a less scope to flourish academically and socially. No post at present in government or privately. Also, there is an accreditation problem. And we need to change our health policy in Bangladesh, Pakistan, and India also. Whereas in pandemic, they are playing a vital roles in decreasing COVID-19, especially in India and Pakistan and Bangladesh. Regarding COVID, your opinion is every patient is unique and need to address as per their requirement. Guideline is not absolute. We have to manage patient according to their needs and clinical judgment. Family medicine is the most important part of healthcare delivery system worldwide, but unfortunately neglected or less focused discipline in South Asia, especially Bangladesh, India, and Pakistan. Without improving family medicine, total healthcare system cannot function properly. We need to convince our leaders to implement family medicine in a reasonable position. Together, we will achieve effective and sustainable healthcare facilities for all, where family medicine doctor will play a vital role. Thank you once again for your presence, and we will see you next time.
Hey, Dr. Salek, would you please give 1 minute for me?
Sure, sir. Over to you, Dr. Kabir, sir.
Thank you very much. Actually, just 1 minute for giving thanks to my learned panelist, especially Professor Dr. Rashid Mahbub sir, Professor Kanabala sir, Professor Raman Kumar, and the Professor Hina Jawad. Everybody has the very practical things regarding the family doctors and the family medicine in our region. And the youngsters, those who are hearing today's webinar, and you're lucky that you could hear from our leaders of this healthcare service. And that Professor Rashid Mahbub sir rightly pointed out that in our education system, we always we taught this our students inside the hospital. But whenever they're coming out from the college, they don't have that much confidence to deal with the patients in the outside outdoor level or at their chamber. So for the youngsters, we want to create some confident family doctors by planning one organized one 6 months, especially initially the 6 months training, so that they can be conversant enough with the family medicine subject, and they can become the confident on the dealings with the primary care patients, and they can give more emphasis on the primary care treatment. And now we for young doctors, you can plan accordingly, and we are trying to create the primary care physicians, so that whenever the government plan to implement these sorts of primary care in our country, like the Western country, or the like establish the effective referral system, at the time this manpower, this the doctors, they will be the leader, they will be the highly benefited. So you just go through all those courses, and you prepare yourself as a family physicians, and you get the chance whenever you are available in your subject. So thank you very much. And Professor Raman Kumar has come, and he very nicely narrated the family doctor's role in this pandemic situation. And we know the Professor Raman Kumar also running one big hospital there, not hospital, that is the outdoor settings maybe, and they're giving tremendous help to the COVID infected patients, and all those experiences, those will help us for our future endeavor. And thank you very much, Professor Hina Jawad, for your kind presence and give us the your valuable time. Thank you very much. Thank you, everybody. Thank you.
Thank you, sir.
Sir,
Thank you.
Sir,
Thank
would you please give any last comment within 1 minute, Professor Raman and Professor Hina?
I think, well, thank you very much again. I think we do need these sessions and the collaboration and the teamwork from the region. We just need to reinforce us and strengthen not only ourselves, but our neighboring regions as well, and just come out as a team. As I said, we need to work in the right direction. We are putting in a lot of effort, and there's a genuine intention in it as well. I think we just need to be more organized. That's all. Thank you.
Sure. Thank you. Thank you, ma'am.
Thank you for this opportunity. Always good to speak to our regional colleagues and hear from them, learn from them. And when we talk to each other, we, a simple definition of intelligent system is one which learns. So if we are open to learn from each other, we are intelligent people, and as simple as that. So thank you, Dr. Kabir, for this organizing this activity. I request you to take, not just on behalf of Bangladesh and your college, but you on behalf of South Asia, you think for using the same platform on South Asia region. So there is no formal process. You have to initiate by yourself. You can do a regional meeting also, regional CME also. You can be a lead for this, and I see you as a leader for South Asia, not just for Bangladesh. So thank you for the wonderful work. I request you to be, organize more such regional events and by yourself. I mean, not necessarily anybody asking you, like you. This, it's a wonderful event. Thank you.
Thank you, Raman sir.
Thank you, Professor Raman. Actually, always we are getting support from you and Professor Hina, and we are actually I'm indebted to the Professor Hina because a few days back she arranged a curriculum of family medicine from their colleges. So I'm very much grateful to you, and all of course to Professor Raman Kumar also. And always whenever we asked anything from them, they are very much supportive to us. So thank you very much again. Thanks everybody.
Okay.
Thank you, sir. Kabir sir. Thank you.
Hope to work together in future, inshallah.
Definitely. Yeah. We look forward.
Thank you, madam.
Sure.
Thank you, sir. Thank you, Kanubala sir, Raman sir. Thank you, Rashidi Mahbub sir. And thank you, Kabir sir, for your presence. And we are looking forward to work with Hina madam and our Raman sir, and with collaboration with Bangladesh and India and Pakistan. Your young doctors are very much excited your announcement. And thank you once again. It's a very late part of the night. Thank you again, and good night. Have a nice day.
Good night. Bye bye.
Good night.
Allah Hafiz.
প্ল্যাটফর্মে কেউ আছো নাকি?